This is Dr. Kelsie Lewis at Glow Dental Co. Dental veneers are thin, custom-made restorations that are typically made out of porcelain. Veneers cover the front surfaces of the teeth to improve your overall smile. Dental veneers can make the teeth appear straighter, wider, brighter, and are known to give someone more confidence in their smile. Patients that typically benefit from veneers are patients with chipped or stained teeth, teeth that appear too small for their mouth, teeth that have gaps in between them, or teeth that have mild crowding or that appear to be crooked. There are a few questions that patients ask, or a few things that you should consider or ask before you go through the veneer process. One of the main questions is, how long does this veneer process take? On average, from start to finish, it can take about 4 to 6 weeks, ranging from your first initial consult to your final cementation appointment. Another common question that we get is if the process hurts or if there's pain involved when you're getting veneers. Typically with the veneers, there's very minimal tooth structure being removed, and we've had patients maybe say there's some slight sensitivity but not any severe pain after, and you will be numb during the procedure, so you will not feel anything. Another common question that we get is, what can you eat when you get your veneers on? You can pretty much eat anything. Things to avoid would be ice or anything super hard, like hard candy, because it can risk chipping the veneers. Another thing would be like sticky candy. For obvious reasons, we just don't want them to pull the veneers off. But for the most part, you can pretty much eat anything with these veneers. You just have to be careful biting into things. Patients are also curious to know how long these dental veneers last. So a typical veneer case can last up to 10 to 15 years. The main reasons that they need to be replaced are if the patient just no longer likes that shade after a certain period of time. And then over time, our gums naturally recede. And so some people tend to want to replace them if it begins to get too noticeable when they smile. Recurrent decay is also another reason why people get veneers replaced, just so that we can take the old one off, clean it up, and then get you a new veneer on there. Another common question would be, how can we keep these veneers clean? To keep the veneers clean, you just brush and floss like you do with your normal teeth. You brush at least twice a day, and then floss at least once at nighttime, preferably. And then keeping up with your regular dental checkups is also important, just to make sure that everything's good, and that they look okay, and if there's any issues that arise, that we can address it at that visit. Another common question we get is, will my insurance pay for it? And they do not typically cover cosmetic procedures, so we do not bill out the dental veneers or cosmetic cases to your dental insurance. Another common question we get is if they're a good candidate for getting dental veneers. So our common dental veneer patients have chipped teeth, staining, severe discoloration, gaps or spaces in the teeth, if their teeth look too small for their mouth, if they have like mild crookedness, or if they have some crowding going on and they don't really want to go through braces, veneers can help make those teeth appear straighter as well. We do get daily requests for these consultations, and we can only provide 10 consultations a month. So to avoid disappointment, it's best that you call the office at 512-814-7823 to secure your spot for our free consultation as soon as possible. Thank you again, and I look forward to being your guide in your smile transformation journey. This is Dr. Kelsie Lewis at Glow Dental Co.